Hello, today I'm going to talk about hepatitis B infection. Hepatitis in simple terms is inflammation of the liver. It has a multitude of causes, including viral hepatitis, autoimmune hepatitis, drug-related hepatitis, alcoholic hepatitis, and non-alcoholic liver disease. The hepatitis viruses include A, B, C, D, and E. When describing viral hepatitis, two key terms are often used: acute and chronic. These refer to the time scale of infections. Hepatitis A is always acute. Similarly, hepatitis E is nearly always acute. These viruses are similar in the sense that they are both transmitted by the fecal-oral route. A key difference is that hepatitis A can cause significant problems in pregnant women. Of particular significance, and often mentioned in exam questions, is hepatitis B. Hepatitis B is a DNA virus, and it can be transmitted in a variety of different ways. For example, from mother to baby during birth. However, it cannot be transmitted in breast milk. Through blood, for example, sharing needles, in tattoos, when getting acupuncture, and between drug users, and very rarely blood transfusion. Sexual intercourse is another method of transmission. As I have mentioned before, key words in hepatitis are acute and chronic. Chronic B hepatitis occurs when the hepatitis surface antigen persists for 6 months or more after initial detection of that antigen. There are many antigens and antibodies in relation to hepatitis. The antigens of note include, firstly, the surface antigen. If the surface antigen is present, we think active infection. Secondly, we have the E antigen. If the E antigen is present, it suggests that the person is very infectious. Thirdly, we have the core antigen. The antibodies of note include hepatitis B core antibodies. These include IgM and IgG. IgM will be present in an acute infection. IgG will be present in a previous infection or in chronic conditions of hepatitis. Hepatitis B surface antibody could indicate vaccination, as patients will have this if they get the vaccine for hepatitis B, or it could simply mean past infection. You need to look at other tests to understand the significance. In adults, acute infection is cleared by 99% of people, so most people will not develop chronic hepatitis B. Now for some quick questions. What tests suggest infectivity? And that is hepatitis E antigen. What two key tests can be done in hepatitis B? And these are the first two tests. So hepatitis surface antigen, this will tell us if there's a current infection, and hepatitis core antibodies, IgG and IgM. And of course there are a range of other tests that can be done, but these are the first two that should be done. Now, our next question. What can patients with hepatitis B be co-infected with? Now, the answer to this is hepatitis B and D commonly can occur together. Hepatitis D is an RNA virus and hepatitis B is a DNA virus. But hepatitis D requires hepatitis B infection for viral replication. What is the management of hepatitis B? Well, in the acute phase, we're worried about preventing transmission, so the patient should be advised and educated about it, encourage safe sex, knowledge about needles, and notification to public health. Chronic, you can give antivirals and other medications. And also, the next question is, what tests should be done in a patient who has hepatitis B? Well, once you know they have hepatitis B, you should screen for the other hepatitis viruses, because they could have one of those as well. You should also screen for HIV, and also you should do alpha-fetoprotein test to screen for liver cancer, and do a liver ultrasound to check for the complications of hepatitis B. And what increases the risk of acute hepatitis infection going on to chronic? Well, a younger age group, as the younger the age, the more likely it is that the patient will become or develop chronic hepatitis B infection. So that concludes this video. Thank you very much for listening, and if you liked it, please do not forget to click the like button and subscribe for other medicine videos.